How's it guys? My name is James. This is that Med Guy. Today we're going to be doing patient assessment. What we're going to be discussing is what you should know or what you could know even as a first aider or a basic paramedic or EMT or wherever you're at in your journey of medical inquiry. This is pretty much the 101 of how do you assess what's going on with the patient. Patient assessment, what is the first thing that you're going to do? If you're a first aider, you'll be walking around and you're going to come across someone who's not feeling very well. Or if you're working on an ambulance or something like that, you will walk into someone's room or walk into wherever the patient is. And the first thing you want to do is you want to stop and just take a moment to take in what you can see. Can you smell things? Can you hear things? Take in more than what the patient is doing, but what is around the patient. The reason why this is important is because you can have all sorts of things happening that you may not pick up on if you don't stop and take that moment. If you jump into what's going on with the patient, you may be not aware of your environment, so that's why we have your hazards. Obviously it's hazards, hello, help. Just stopping for a moment and taking on hazards is a part of that patient assessment. As you enter the room, there is something called a patient assessment triangle. What this looks at is it looks at the patient's work of breathing, looks at their color, and it looks at their appearance. What this means is that when you walk into the room or into wherever you are, you can look over across the room or to the patient and you can see how hard are they working on breathing? What position are they lying on their back? Are they lying on their stomach? Are they sitting? Are they standing? Are they short of breath? Are they struggling to breathe? Are they coughing? What is going on with their appearance? Can they move? Are they looking at you? Are they aware of you? So these are all questions that you can assess just by having a look at them. So in terms of color, are they pink? Are they well perfused? Or are they very pale? Are they sweaty? Then in terms of their appearance, do they look well? There was a study done that looked at a first impression of a patient. There was a study done that looked at the first impression of a patient. And generally speaking, when we look at someone and go, he doesn't look very well, that is actually quite a strong indicator of someone who is clearly not doing well. And I know that's something very silly to say, but if you look at someone and you go, I don't know what's wrong, but they look okay. I'm not saying they're definitely okay, but there's a good chance that they probably are. In the other circumstance, you may look at someone and go, they look very unwell. And you're probably very right. And that is a good way to really judge left and right if you're not sure which way to go. Then once you've looked at their color, you've looked at their appearance, you've looked at their breathing, then you can assess the patient. So in first aid, which is always where we should start with the basics, there's hazards, hello. So we assess their consciousness. We assess if they are awake or not. So there's something called the AVPU scale, which is AVPU. A is awake. V is verbal, meaning the patient responds to a verbal stimulus. So you go, hi sir, what's wrong? And if they look at you, then they are responding to a verbal response. Then there's a pain for P. P is for pain, so that is a painful stimulus. So if you shake their hand or you grab them in their shoulder, not to cause them pain, like assault them, but to just try and wake up, like someone who's sleeping, you're trying to wake them up. And if they then awake to pain, then they are responsive to pain. Then there's the U for unresponsive. So even if you give them a painful stimulus, they then don't wake up. That is a sign that they are very much unconscious. And then there's hazards, hello, help. Then you call for help, whatever number, 999 or 911 or whatever country you are in, use that number obviously. So now that you know that there's no hazards, you've looked at their appearance, their color and their breathing, and you've assessed how awake or not awake they are using the AVPU scale, you have then pretty much done your initial assessment. That is going to tell you a lot of information. The next thing that you can do is that, because as a first aider or as a first responder, you really want to just be focused on their airway breathing. So if they are at least awake or responding to verbal or painful stimulus, it obviously means they're doing much better than being completely unconscious. So you want to assess their airway, their breathing and the circulation. So how do we assess airway? You want to be looking at what can you hear from the person's mouth. We are looking for whether the patient is maintaining and protecting their airway, meaning that if they were to vomit or if they were to fall backwards, are they going to be choking on their tongue or are they going to be choking in their own vomit? Things that you can look at are, is the patient swallowing their own spit? So even if an unconscious person's lying on their back and they're protecting their airway, they will swallow. So every now and again you'll see them swallowing. That shows you that they're maintaining because they're constantly producing saliva, you need to swallow that stuff. Some people might say, well, if he has a gag reflex, then he's protecting his airway, which is actually not true. There's a large population that has no gag reflex. So looking for a gag reflex is really not that helpful. If you have no gag reflex, please drop a comment in the bottom and we'll see how many of you guys don't. Are they swallowing? Can you hear any sound from the airway? You should just be able to hear air coming out of their nose or their mouth, and that's it. You shouldn't be hearing bubbling noises or snoring noises. If you are hearing snoring, then the patient is probably unconscious or quite unconscious, probably responding to pain. You don't want to put them into the recovery position. I have made a video on this. So just put them on their side and keep them on their side. Keeps the tongue forwards. You can choke on your tongue because all your muscles relax and fall backwards into your airway. So now that the airway is clear and we have air movement in and out, that's what we need. So then there's airway breathing. You want to assess the breathing. How fast are they breathing? Normal breathing is like 12 to 20 breaths per minute. So you can look at the patient and you can count their breathing. If you count for 15 seconds, you can times by 4. If you count for 30 seconds, you can times by 2. If you really want to count for a minute, you're welcome to. Then the circulation. So what you want to check is a capillary refill time, or CRT. All you have to do is take your finger or the patient's finger and you squeeze like that. And once you've been squeezing for like 2 or 3 seconds, you let go and you see how long it takes to go back to red. So you push all the blood out of the fingertip, bring it above the heart, and you let go. And it should take 2 seconds or less. So if it takes 1 second, that's fine. But if it's slower than 2 seconds, that's a slow capillary refill time, and that shows that there is not so good perfusion or they're very cold. So perfusion is just the oxygen and the minerals in the blood getting to the organs where they should be going. If you're not being well perfused, there's probably something wrong with their heart. Their lungs are probably fine, but it's more of a heart pumping issue than a breathing issue in terms of perfusion. And then you want to feel for a pulse. So if you take someone's arm like this and you just put your finger right there, you will feel someone's pulse. So a better way to do this is if you just take your 3 fingers, put it onto your radial, which is your bone at the top of your arm or by your thumb, and you just roll it down. You should be able to feel your pulse. Do that now, it's probably good practice. If they're unconscious, you can feel in their neck. If you just put your fingers on their Adam's apple and you just push into the side, gently, you will feel your carotid pulse. Don't worry about blocking it. You've got like 6 carotid pulses. You have your external, internal, and one going down your spine. So don't be too concerned about stopping the blood getting to their head. And a pulse rate should be between 60 and 100. You can count for 15 seconds and times by 4, or count for 30 seconds and times by 2. It's just how many beats there are in a minute. If it is slower than 60, obviously that's a problem. Some fit people have slow heart rates. That's okay, but if we're hitting like pulses of like 30 and anything closer to 40, 30, that's quite significantly slow. There's probably something significantly wrong. And then on the other side of the scale, if their pulse rate is above 100, you obviously have something else going on unless they've been running a marathon. There's also been studies done on pulse rates, and for someone who has a medical illness, so not like trauma, like medical, like chest infection or whatever, sepsis, something like that, and their heart rate is above 100 and they're at rest, so they're sitting in a bed, and their heart rate is above 100, that shows a significant illness and that they should definitely get help. So if you check someone and they are breathing faster than 20 and you check their pulse and their pulse is at 120, 130 and they're just sitting there, there's clearly something wrong and you should get that checked out. So that's airway, breathing, circulation, and the patient assessment triangle. And guys, I hope that was helpful. I know it's maybe a bit long, but it is important that first aiders or basic EMT, or even as a paramedic myself, this is a system I go through. And everyone needs this system, because when we approach someone who's unwell, we need to know what we've done and what we haven't done. And then when you're not sure or something changes in the patient, you just go back. So guys, if you did like this, please hit like and subscribe, and we'll see you in the next video. Bye for now.